Hi, my name is Cassie Meyer. My proctor told me to begin at step 5, and the first thing I want to tell you is that I would have my gown on, but it's ripped on the sleeve, so I can't put on my sterile gloves without contaminating, because you have to put the sterile glove over the gown. So it wasn't working. So to begin the procedure at step 5, the first thing I'm going to do is put the towel over my patient's gown. So to not spoil or soil his gown during the suction process, now I'm going to set my pressure at 100 to 150 millimeters of mercury and not exceeding 180 millimeters of mercury. And I'm going to set my FiO2 at 100%. And here's my suction tubing that I'm going to connect my catheter to. So now I'm going to set my sterile field by opening my suction catheter tray, only touching the outside 1-inch border. And now I'm going to take off my clean gloves. And now I'm going to put on my sterile gloves. All right. So now I'm going to move that into my trash can, and now I'm going to take out the saline solution and uncap it and set it on a flat surface, and I'm actually going to put the cap down on the table without touching the table. Now I'm going to take out my catheter tubing and throw that away. And since I'm left hand dominant, I'm going to maintain my catheter in my left hand. And I'm going to pick up my suction with my right hand and connect the two. So my left hand is still sterile. The first thing I'm going to do is check to see that this is suctioned, or the suction is working, and it is. So now I'm going to coil that back up. Take off my patient's oxygen mask and hyperoxygenate my patient with 5 to 6 ambu bag breaths over 30 seconds. So I would take a little bit longer normally. Next thing I'm going to do is begin suctioning. So I have not touched the tubing anywhere else except my glove. And I'm going to insert it into the nasal cannula when the patient breathes in, and I'm going to feed the tube down. I haven't touched the patient's gown or anything but my glove with the tube. And once I hit resistance, I'm going to stop, pull back a centimeter, and begin intermittent suctioning, bringing the tube back and forth as I remove the tube. And once it's out, I'm going to encourage my patient to cough and clean out the tubing. And then I'm going to hyperoxygenate my patient and encourage him to cough. So I'm going to do this 5 to 6 times with the ambu bag over 30 seconds, so I would normally take longer. And the next thing I would do is check vital signs throughout the whole process actually, and make sure that my patient's beats per minute does not increase or decrease by 20 beats per minute, or his oxygen saturation does not drop below 90% or 5% below his baseline. If it does, then I would discontinue suctioning. So now I'm going to insert the catheter one more time, only into the nasal cannula without contaminating the outside or his gown, touching it to his gown. And I did this when he breathed in. And now I'm going to hit resistance, pull it back 1 centimeter, and begin suctioning and pulling the catheter back and forth over 15 seconds. Okay, and once that is out, I'm going to wrap that up and hyperoxygenate my patient 5 to 6 times over 30 seconds. And reapply oxygen therapy. And the next thing I'm going to do is clean up my supplies by First, making sure my sterile, well, disconnecting this and taking off my sterile gloves, glove to glove. Oh, they broke. It's not happened to me before, so. Okay, so I'm still gonna grab the middle of the glove. If you can see, it's still the middle, not the cuff. Oh my goodness. Okay. Ugh. So I'm doing it towards the trash can. I'm gonna grab that, okay, and skin to skin. Okay, so now I'm going to clean out my area and throw this away in a minute and reapply clean gloves and begin auscultation.